Welcome back to the channel, guys. My name is Steve. This is my wife, Lindsay, and today we're going to be reacting to how the UK's healthcare system works. Now, I've learned some things about the NHS over the last year or so, but this will be the first time that Lindsay's learned anything at all about the NHS. What do you know about the NHS in the UK?
That it's socialized healthcare, right?
Well, yeah.
Everyone pays in a little
right,
and covers everyone else's expenses, right?
Versus our private healthcare system.
Yeah.
Now, we do have something similar to the NHS in some regards. We have Medicaid and Medicare, which are for low income
or older people,
disabled or older people. So that is a form of socialized medicine in a way. But for the most part, if you're of working age, you are
responsible for your own health coverage.
Yeah. Or if you're not disabled or anything, basically you are responsible for your own healthcare coverage. As I'm sure most people in the UK probably know, it's definitely a hot topic here in the US. And I'm guessing it may be a hot topic in the UK as well in some regards, because I'm sure there are people that, I know there's people that love the NHS, and I know there's people that don't like the NHS. Right. And so we did actually do a video probably, 2 or 3 months ago about US versus UK private healthcare and what it's like to actually see a doctor within the private healthcare system in the UK. And that was pretty eye-opening. You know, up until that point, I had only looked at the NHS, so I really didn't know private doctors were that much of a thing in the UK. But it turns out, you know, it's actually much larger than I thought it was, you know.
And apparently a lot of NHS doctors also do private.
Right, they go back and forth, which is pretty interesting.
Kind of
you know, I'm guessing they may get paid a little bit more in the private setting versus NHS, but the NHS probably it's just. I'm guessing it's easier for the doctors to function in, maybe even if they're getting paid a little less. I don't even know that. Maybe they get paid more in the NHS. I just figured maybe they probably have set pricing in the NHS, which I'm guessing in the private system they don't have. So I'm guessing
they can kind of set their own.
Right. So but Lindsay has been wanting to check out, learn about the NHS and the UK healthcare system for quite some time now. All right, you got anything you want to add before we get started?
No.
All right, guys. Let's go ahead and check out how the UK's healthcare system works.
The US already spends more money on healthcare than any other developed country. There's one country that spends less than half what the US does on healthcare, and people generally don't pay anything out of pocket when they go to the doctor. The United Kingdom. And out of all the healthcare systems we've looked at, the UK appears the most socialist. The government effectively runs the whole thing. Right now, the UK is having its own debate over how to reform the National Health Service. So how does the UK system compare to the US? And what reforms may be coming? In 2018, the United States spent around $10,500 US on healthcare.
Look at that. That's per capita.
That's insane how much more it is than everyone else.
You know what's funny? Like, when's the last time you actually went to a doctor other than in 2020 with that, or 2021, 22?
Like other than emergency scenarios?
Right. So you went to an actual doctor for a checkup or something.
I really can't remember.
I know. Isn't that something? Isn't that crazy? Would you be more likely to go in a system that it covered you fully?
I mean, obviously I'd be more likely to go, but I feel like I'm still the kind of person who I just don't want to go unless it's absolutely necessary.
Right. I'm pretty much the same way. But
yeah, if you didn't have to, which I think we see that here with people who are on,
like my mom.
Yes, with people who get the free health care, they are more inclined to go.
I do notice that, if you are either on disability or if you are retired and you have Medicare, people that have the government provided health care in general, you do seem to see them using doctors more. A lot more. Yeah. I mean, I think it's partially money, but it's also, some people just like us, we just generally don't go to the doctor that much unless we absolutely need to. That's could be good or bad depending on how you're looking at it. But that is insane, though, that it costs that much. And I know a lot of that here in the U.S. is just red tape, bureaucracy, just
price gouging.
Gouging, yeah.
That's a video we want to do, actually, because the other day we were cleaning and we found like a what is it? Like a cost breakdown
of a few different
the hospital visit
from when you were in the hospital briefly in 2022, or I don't remember when that was. But yeah, and I also had where I had to go to the emergency room like once, I believe, and I had, and it's insane. It's insane what they're charging you.
Yeah, I think we even have that for Sophia's birth too. So
I don't know where that's at. I want to see that.
I think we have it somewhere. So hopefully we can dig all that.
We'll have to look for that because that I thank you guys for finding that interesting.
I think so too.
Care for each of its residents. The United Kingdom spent around $4,000 US. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending
that
less,
might not seem
the
like
United Kingdom
a big difference, but it is huge.
Citizens who live longer and are less likely to die in childbirth.
Well, one thing I want to say about the healthier citizens, I believe also a lot of that has to do with food quality.
Absolutely. Like the standards that you have for what you allow or don't allow in your food or in the preparation of crops. Yeah.
But I do believe the cost of health care can be a hindrance to certain people when they probably should go to the doctors, choosing not to, and then stuff getting worse and worse because they don't go take care of a problem. And that can also reduce lifespan. And I mean, I mean, we look at this 81 versus like 78 and a half, you know, on the surface, that doesn't seem like a lot, but when you average it out, that is quite a bit.
I'm kind of surprised at Italy and Japan. I would have thought they would be higher than the US.
Life expectancy at birth. Wow. That is pretty interesting. I don't know what that is. Look at France. That's wild, man. So Germany and UK get pretty close to each other there.
2017, life expectancy in the UK is higher than in the US.
Oh, wow.
Look
at Japan.
Has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States.
That's something I'm curious about. Again, I want to look into the birth situation like you do as well. And I wonder how prevalent are midwives in the UK versus the US?
I think it's majorly different.
I do too. And I think that is a major component.
I think here in the US, one of the reasons our infant mortality rate is so bad is because there's a lot of intervention when it comes to birth. Instead of looking at it as a natural process, we look at it more as think about it. We go to the hospital and not usually for midwife care. It's for surgeons
I want to say this from just the experience we had 5.5 years ago or whatever it was for Sophia, right? They normally want you to, you go into the sterile hospital room and you have all these people running around, chaotic. You have a doctor instead of a midwife usually delivering you, telling you to lay on your back and push out at a particular time instead of sitting how you want to, being upright on a bouncy ball, being in a tub, all these other things that make it a simpler process, make it a more natural process.
Not just that, but I think here, when you have your baby at the hospital, you're automatically on a timer. So the more they can get through, the more money they can make. So I don't know how it is in the UK, but here, once you get there, once you're checked into the hospital, they're wanting you to speed things along. And if you're not, they're going to do things to help you or make you speed things along.
Down to the fact that they don't even want to wait for the umbilical cord to quit pulsating. You know what I mean?
I wonder, do you guys do that in the UK? Do you completely let the umbilical cord, all the blood leave to the baby? Which, I mean, I think that's standard, but it's not here.
I know it's not here. And that's such a disservice to children because it might not seem like much, but if you look at the research, that's huge.
I forget how many liters of blood are normally left in the placenta and the umbilical cord because we don't.
It's huge, man. Totally. It's a shame that we do not allow the birth process to be a more natural experience in general. And to me, I think that is one of the reasons why we have a higher infant mortality rate in the U.S. Now, I'm sure there are other aspects around that. You know, I don't know, when do you consider an infant dying to be part of an infant mortality rate? Is it just at birth, or is it for the next few days, weeks? What is that?
It says deaths per 1,000 live births.
So is that right away? So that's right away. So that would be more of the possible traumatic experience going on between mother and child during birth, and then maybe some of the intervention, maybe who knows what it really is. But, you know, that's something we both find really interesting, you know, just it really is interesting what's going on with the birth system. Oh, that's another one. I don't know how this is in the UK and other countries, but in the US, now, this is not our experience, but a lot of women are daughters want to schedule their births in. So they'll schedule them in
like a C-section.
For a C-section,
which is major surgery.
You know, and when she's healthy enough to just go through the live birth, through the natural birth process, but to get that on a schedule, they actually go and do a C-section, which is it just boggles the mind that that's even a thing when it's not necessary.
Not usually.
No, of course, when it's necessary, it's necessary. But I'm saying in the particular cases where it's not necessary and
it's a choice. Like, it shouldn't be a choice unless it's necessary.
Right. Why are you going to go and schedule something like that?
Yeah.
You know, anyway.
And the maternal mortality rate in the US is nearly 1.5 times higher than in the United Kingdom. So how is the UK system structured so that it gets these results while spending significantly less than the United States system?
The National Health Service is a case where the British decided right after World War II that healthcare should be government's job, like paving the streets, putting out fires, running the library, running the parks.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different countries' healthcare systems.
It's a service you get when you need it, and you never get a bill. It's like going to the library. They don't charge you to check out a book.
Key thing about the NHS is it's a risk-sharing system. So everyone pays into it through their tax. If you need to use it, you don't have to pay anything else. So in a sense, it's not free because it's paid out of taxation.
Right. Dr. John Puntis is a pediatrician who recently retired from the NHS. He is also co-chair of an organization called Keep Our NHS Public. All of his comments are reflective of the organization and not his personal views.
It's a fair system in that the more money you earn, the more tax you pay, and the more you contribute. But there has been discussion about whether tax should be increased to pay for sorting the NHS out into.
What do you guys think about that? If you are currently paying into the system because you're of working age, would you be okay with a tax increase for the NHS if that's what it took to keep it solvent? And I'm curious, like, what percentage of your income do you generally pay now into the NHS through your taxes? And how much higher would you be willing to pay in order to keep it solvent for the next, for the foreseeable future?
In terms of the current deficiencies and problems, and that is controversial. I think a lot of people favour some tax increase, but then there are other people who say, well, maybe the focus should be on companies that don't pay tax and people that aren't paying tax as the first step.
I would call that socialized medicine. Government provides the care, government pays for the care, it's paid for through taxes, everybody's covered the same. To me, that sounds like socialized medicine.
The term socialized medicine has become a political football, especially in the United States.
If the NHS, if that's socialized medicine, it's great. And we hear this term mainly coming from the US, where it's used as for scaremongering. I would say if the NHS is socialised medicine, we like it, and most people are still very, very supportive of the concept of a national health service.
I will say this, that in my comments section, I've seen numerous comments, both good and bad, for the NHS.
Yeah.
But I will say, it seems like the majority of you guys in the UK, at least from my comment section, seem to like the NHS. But there are people, I would estimate about 25% are, maybe 25%, somewhere around that, are have something against the NHS.
And the biggest complaint I feel like I see is wait time.
Yes.
For certain things.
Yes.
And yeah, that would bother me personally.
I think potentially, now I don't know this, but I think the wait times for certain services, certain surgeries and so forth, to see certain specialists, I think maybe that could be because there are simply not enough of those specialists in certain areas in the UK. And if you live in that area, you might come across this when you need to get that surgery or see that type of specialist. And so that wait time goes way up because you don't have access to it.
And also kind of along the lines of what we were talking about earlier, if a service is free, then people who don't necessarily, I'm not saying everyone who schedules the appointments for certain specialists don't need it. That's not what I'm saying. But I think that the more likely you are to seek out a service, even if it's not an emergency, if you don't have to pay for it. You know what I mean?
Well, I mean, I think that's a given because that happens here.
Right.
Like
that's what I'm saying. So I think that makes the wait times longer too.
Probably so. Probably to a certain extent. Yeah.
Each of the UK's 4 constituent countries have their own branch of the NHS, so rules differ slightly between them.
That could be part of it too.
All of the branches operate under the purview of the UK Parliament. There are some services that require patients to pay something out of pocket, such as dental, eye care, and certain prescription drugs. But those fees are low compared to the US and vary by NHS branch. By one estimate from a data analytics firm, prescription drugs cost 57% less in the UK than they do in the US. Unlike with other universal healthcare systems that are only publicly funded, the government also runs the NHS. That means doctors that work in public NHS facilities are employees of the government. Most Britons receive their primary care through general practitioners, who are frequently referred to as GPs. They typically act as gatekeepers for secondary care.
The problems that people are experiencing at the moment is it's taking longer to see your general practitioner if you want to see them.
Most GPs are private contractors with the NHS. They don't charge patients for care. Instead, they earn money directly from the National Health Service. Many GPs negotiate contracts with the NHS to determine how much they can charge the government for their services. GPs may fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of Medicine found that GPs face many issues because of how general practices are funded in the UK.
Some GPs, I think increasingly, don't want to take on the running a business aspect of general practice. And so there are lots of GPs who are salaried partners, so they are paid by the practice to come in and work as a GP.
So kind of like a hairstylist will rent a chair.
There's also a private sector in the UK's healthcare system. It's funded from a combination of out-of-pocket payments, private health insurance, and the NHS itself.
I'm curious, guys, who has private health insurance in the UK? That's something I've never heard anyone really talk about. How much are you paying for that? And I'm really curious for people that actually get private health insurance in the UK to go see private doctors.
What is your primary reason?
Right. What is the reason?
Is it the wait times, or is it the care itself? Like, do you feel like you get better care when you're paying?
I don't think, based off of what I've heard, I feel like most people say they get great care from the NHS.
Well, then it's probably the wait time.
I'm thinking that might be the majority of that. And I'm sure in some areas, like maybe if you go to some of the bigger cities, maybe the wait times aren't that bad at all.
I don't know.
Either let us know in the comments, guys. We still got a long way to go to really learn the ins and outs of what you guys are experiencing in terms of your healthcare systems.
Private sector is growing because it's being consciously promoted by government, and the boundaries being blurred.
Well, I think that private healthcare has been growing at a very rapid, steady pace in the United Kingdom for the course of several decades. That's going to continue.
That's Niall Gardner. He's the director of the Thatcher Centre for Freedom at the Heritage Foundation.
With regard to the National Health Service, I mean, there's no sign at this stage that the UK will be moving to a different system to the National Health Service. All British parties are committed to the National Health Service. I think that more and more Britons will be opting for private healthcare in the coming years and decades, not least because there are long waiting lists with regard to the National Health Service.
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal year, NHS England spent around 18% of its total expenditure on the independent sector.
There's been a blurring of the boundaries, if you like. For example, cataract surgery, which is the most common operation done under the NHS. Increasingly, it's being provided in the independent sector, and the NHS has contracts with the independent sector to do that work. There are implications in terms of staffing. Private sector doesn't train its own staff, it takes it from the NHS. It cherry picks, takes the low risk patients, not the high risk patients. It has an impact on training NHS staff, and this is one of the problems with cataract surgery. If they're all going to the private sector hospitals, then the NHS staff don't become experienced in doing cataract surgery, and then along the line you find it's more difficult to staff your NHS unit. So it's not without negative consequences. We are paying private companies increasingly to do work for the NHS, including American companies, and they're very well established now, particularly in back office functions and providing advice on commissioning support, this kind of thing.
Well, the interesting thing is here, he's talking about how the NHS contracting with these private companies and these private contractors. But isn't that what the NHS is made of, is a bunch of individuals that, like individual doctors that may go back and forth between private practice and then choose? Isn't the NHS basically just private doctors and service providers that may choose to contract with the NHS as well?
That's how I took it.
That's how I felt it was, because I know that the contractors, the doctors, like a general GP, he might be with the NHS for a while and then choose to go to his private practice, or vice versa, right? And they just get, and basically they're the same provider. They just get, they personally get paid in a different way. They're contracted with the NHS, or they're charging the public personally, right? That is something I'm so confused on here, unless he's basically, this person right here is mainly, maybe he's talking about these mega corporations and they have their own physicians and surgeons and whatnot. Maybe like the Kaiser Permanentes of the world, so to speak.
I don't know.
I don't either. It's a little bit confusing there.
They're very involved, and unfortunately that's likely to increase, and it's something which campaigners are extremely worried about.
I don't think anyone really believed that UK voters would decide to Brexit.
The news that the United Kingdom voted to leave the European Union shocked the world. The NHS was a big part of the Brexit discourse. With the
I know it's very controversial.
Very.
I don't know what the main motivation was, though.
Do you know what the vote line was?
Wasn't it like 50-50 almost?
It was almost,
like,
it was, I can't remember if it was 49-51 or if it was it was so.
But I don't know the
close.
specific reason why most people wanted to leave.
This is a very hot topic. Even in my comments when I've just briefly talked about it, I get 50% that are like pro Brexit, 50% that are very much against it. And it's like, I think some people get mad at me, and I'm just a neutral person here, because I've experienced it. I didn't experience it before or after. I have no idea. All I can do is learn a little bit about what it is and whatnot. But you know the gist of what Brexit was, right?
Well, they were in the European Union, and now they're not.
Right. Yeah. That's it. But so you have...
I don't know why some people, like half the country, wanted to leave and the others didn't.
Now, something to keep in mind, Ireland isn't part of the UK. Northern Ireland is part of the UK. So Northern Ireland is no longer within the European Union. But Ireland is still within the European Union. So there's a lot of nuance to all of this, right? So we'll have to look into Brexit in a different video at some point.
The Leave campaign famously claiming that the UK would take back £350 million a week that could then be funneled into the NHS. The UK Statistics Authority has since said that the claim is a, quote, clear misuse of official statistics.
My name is Holly Jarman. I'm an assistant professor in the Department of Health Management and Policy at the University of Michigan. Those promises really did hit home for a lot of people. The idea that money would come back from Europe to the UK was a very powerful symbol.
Okay.
It's not actually true. That wasn't really how EU financing works. But we still saw that was a big part of the media discourse and most likely part of people's judgment when they were casting their vote.
The UK officially left the EU 3 years after the original Brexit vote, entering a transitory period through the end of 2020 while the UK government negotiates international trade deals. The concerns about private American corporations engaging more with the NHS came up during the discussion of the post-Brexit trade talks with the United States.
When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that.
Backlash to President Trump's comments on the NHS led to many British politicians assuring their constituents that the NHS was not going to be a part of the trade talks.
The NHS is in no way on the table.
President Trump then backtracked on his comments, saying he wouldn't consider the NHS as part of the trade deal.
A lot of trade negotiations are actually quite secretive by nature. The two sides don't really want to reveal a lot about what they're looking for in a deal. Our concern really as health researchers is that the NHS really won't be accounted for in that deal. That the UK government's preferences have been shown to be largely economic and not so much on the focusing on the health of people in Britain.
The problem is that
I personally talked to enough people in the comments and seeing all the comments, I can't imagine that that the NHS is going anywhere.
No,
like
for the foreseeable.
Now, I could see the private healthcare system, if enough people feel like they need to get seen faster in certain situations, and maybe that might be the way they look at solving that or something. I can see maybe the private healthcare system growing some alongside the NHS, but the NHS, I can't imagine it's going to go anywhere. Too many people love it and use it for it to just disappear.
Yeah,
I think that there would be a huge uprising if they just took it away or something.
Yeah,
so yeah, that's I don't think that's going anywhere necessarily.
the NHS is already on the table. It has been for a while. Campaigners were saying, okay, put your money where your mouth is. If you're saying the NHS won't be in a trade deal, then let's see legislation that sets that out so it's cast in stone. And they haven't rushed to do that.
There are some who say the NHS won't be harmed by Brexit, even in the event a trade deal with the EU isn't reached by the end of the year.
I don't expect that we're going to see huge changes actually in the Brexit era with regard to the National Health Service. And so I think with regard to the NHS, we're not likely to see a significant impact as a result of Brexit. I think the free trade deal will be largely focused upon the service industry, which of course is now the largest part of both the US and British economies.
Whatever effect the trade deals end up having on the UK, reforming the NHS will continue to be a big part of the country's political conversation.
People's support for the NHS in the UK is very strong. There's no other country that, when we hosted the Olympics in London, we had nurses jumping on beds, and the NHS was actually a part of that ceremony.
I don't know how I've seen that, but I've seen something of that, a clip or something.
In British politics, it's an important symbol of Britishness in that context.
Yeah, it definitely is an important thing to British people. I think even though it's the first time you've looked into the NHS at all, I think you probably could have seen that somewhat in just, the little bit that you... Right. I will say this. Our healthcare system in the US is broken. Beyond broken.
For sure.
Beyond broken. I mean, and my thing is this. There is no reason why someone should ever go to the hospital for an emergency and then get out and they are left with this
a mountain of debt. Yeah.
$250,000 of debt, and they make just too much to write it off. and their insurance only covers a very small portion of it.
Right.
That type of situation is the biggest problem to me.
Mm-hmm.
And I've said this numerous times. The problem with our healthcare system in the U.S. is not quality, in my opinion. And in my opinion, I always felt like I got good quality healthcare, whether it was in a doctor's office or whether it was in a hospital. I feel like our quality healthcare has been fine. I've lived in numerous states, and everywhere I've gone, didn't really have an issue with the quality healthcare, me personally, right? I can disagree with some of the things that are recommended. I can disagree with the way we do, like pregnancy, like the way is systematically approached in this very dry, impersonal way. You're a number. We need to get you on.
An emergency situation versus a natural part of life.
There's so many different things that I do disagree with systematically. But when it comes to what a big reason for people like in the NHS is because no matter what, they're always covered from birth to death. And in the US, we potentially can get a big mountain of debt depending on certain circumstances. How good is your insurance?
Right.
But here's the thing I always say. I've said this numerous times. It's not the really poor that have to worry about it. It's not the really wealthy that have to worry about it. It is the middle class in the U.S. that are the ones that are harmed by our current healthcare system. Because if you're very poor,
yours is free.
Your healthcare is free. You have socialized medicine if you're poor in this country,
or older, or disabled.
Yeah, or if you are, or if you're wealthy, you can cover it yourself. But middle class people, someone making $50,000 a year, they can't really afford this super great health insurance. They go to the doctor, have a $17,000 deductible, blah blah blah. Now, I think that is something that people they don't understand about our healthcare system. They think that people are just dying on the streets or something,
right?
Which is not the case, because by law, you cannot turn someone with an emergency situation away. So if no matter who it is, they have an emergency situation, they go to the hospital, to the emergency room, they're going to be
legally, you have to be helped.
Legally, they have to be helped. Yeah. And if they are low income, most hospitals have something called charity care, where will either forgive the entirety of the debt or a portion of the debt. So low income people generally don't have to worry about it. So it's mainly the middle class that are stuck with this issue. I can see how good that would feel if you could just say, I'm gonna pay, I don't know what the percentages are, right? But if I could pay, say, a few percent, 5% of my income into the system, and then I know that I'm good, I'm covered. I mean, I do feel like that'd be a pretty nice feeling to not have that over your head. If like you need to go to doctor for something, you don't have to like, oh man, do I really want to pay that bill? Or, it's just, it is pretty nice that
but for me, wait time would be a major importance.
Right. So I think it would depend on wait time.
So if that's like the main qualm that most people have with socialized healthcare, like the NHS, then that's one reason I'm wary of being like, oh yeah, I want to adopt something like that here in the US, because
Yes, I totally agree. It would depend on a certain circumstances, but definitely appreciate it on the surface at least, of like, can you imagine what that would feel like? You can go to a doctor, never have to worry about a bill. That's pretty cool, And I think that since the U.S. system is broken, we should in the U.S. be open to discussing, looking at certain other systems like the UK's and being like, even if we don't adopt the system entirely, what of the system can we adopt into our society to make things a little bit better for everyone, right? And unfortunately, we live in such a partisan society that it's not just healthcare, it's every single thing across the board. If people on both sides of the aisle are willing to meet in the middle on any subject, we would have a better society, right? But like,
I feel like that goes
people have their positions and they are not willing to meet at the table in any regard. And I think that is one of the biggest problems we have here. But
yeah, definitely.
But I think we're getting off on so many different tangents here of taxes and political stuff and whatever, when in fact we're just learning about the NHS system here. Did you learn anything new here?
Yeah, definitely. I mean, the only thing I really knew about it was that it was free. And yeah.
So you learned a little bit more of the ins and outs of it. And,
yeah.
But do you have anything that, I mean, I think I gathered what you said. You would want to know more about timing and stuff like that, right? And I do too, guys. Let us know in the comments for situations that you've had, whether it was surgeries or seeing specialist stuff. How has the timing been in your area of the UK when it comes to like seeing a surgeon or seeing a specialist? I'd be curious to know how that's going for you. But
yeah,
you got anything you want to add before we go?
No.
All right, guys, let us know. Suggest anything, related to the NHS, UK births, pregnancies, probably things we haven't even mentioned here. Feel free to leave your suggestions. We always appreciate your recommendations. But anyways, guys, thank you so much for stopping by. Please click that like button. Feel free to drop your comments or suggestions about this video or others. And don't forget to subscribe to continue to follow us on our journey to discover anything and everything about the UK and Ireland. Until next time, guys, peace.
Bye.